principally an obesity medicine practice where I help patients manage their weight and look after their weight-related health problems.
Okay, and you're also, a mother of two, right? So you have to deal with grocery shopping yourself?
That's right. So, I've really tried to think both for myself about going out grocery shopping and what I need to do to protect myself and my family, as well as been giving patients advice about what they can do to protect themselves when they're out grocery shopping. So I've really tried to understand this issue and seek some clarity around how we can best prevent the spread of COVID when we go grocery shopping.
Excellent. So just remind us, as a medical doctor, obviously you look at these things slightly different, maybe than from a lay perspective. When you think about going out and shopping, we hear a lot about physical distancing. So what does this actually mean for someone who needs to go out and shop for groceries or something else?
Right.
What's the most important thing you need to keep in mind?
Right. So the reason why we've been advised to take these physical distancing measures is because we know that COVID spreads from person to person. And if we're maintaining distance from people, then that helps prevent spread. Now, in terms of grocery shopping, I sort of think about two different aspects. One is trying to stay out of the grocery store as much as possible, having as few people as possible visit the grocery store as little often as possible. And the second aspect of physical distancing at the grocery store is if you do go to the grocery store, how do you maintain enough distance from people? So when we're thinking about that first aspect, let's go to the grocery store as little as possible. One of the great things I think that a lot of people have been doing is instead of going to the grocery store and doing their shopping, they've been making arrangements to have their groceries either delivered or to use that pickup service. So that's a really great thing. Now we know locally where I've been shopping, those services have actually been overwhelmed. And so now it takes you need to make those orders about a week in advance, and that's just simply too long for a lot of people. So I do think that going to the grocery store at this point in time is unavoidable for a lot of people. Now that said, how you can limit how often you go to the grocery store is of course by planning ahead, which is something that our patients are already really good at. They're always doing meal planning, making a grocery list, and making sure that they have enough supplies on hand for probably at least a week ahead would be a great goal. Now, I went to the grocery store this past weekend, and I saw a lot of couples shopping together. And usually I would say this is a really great thing. Plan a meal together, go buy the groceries together, enjoy making the meal and eating the meal together. But at times like these, it's really important to limit how many people are going to the grocery store. So just send one person from your household in to do the shopping. This isn't a time to be shopping together. And also, really importantly, leave your kids at home when you go grocery shopping. This is going to be particularly important for little kids. I know that when I take my kids to the store, it doesn't matter how much I remind them not to touch things. They're constantly picking up candies and asking me if we can take them home and smelling things and touching things. So please leave your kids at home. The other thing, and I think this is something that we've all been talking a lot about, is the importance of helping one another. So before you do go to the grocery store, maybe just check in with other family members, your neighbors. Say, do you need something that I can pick up really easily for you so that you can delay grocery shopping for a few days? Can I pick you up some milk and some eggs, and then you don't have to go shopping for another few days?
Now, what I've noticed is that there are often lineups in front of the grocery store. And so you probably have to take extra time. You're not going to just rush in and get something. It could take you half an hour to 40 minutes by the time you get into the store and out of the store. Has that been your experience, or?
Yeah, that has. And as much as this is annoying to have to wait at the grocery store, I'm actually picking those stores where I can tell that they're taking physical distancing really seriously. Those are the stores that I go shopping at because those are the ones that I feel safest at. So I'm going to stores where They're limiting the number of people that come in, so I know that it's not going to be crowded in there. I've also been really happy to see that at some of the grocery stores that I frequently go to, they've removed some of their aisle displays so that it's less crowded as you're moving through the aisles. In stores that have narrow aisles, I'm now seeing that there are arrows that they're marking to make the aisles one way. And that's something that's really new to people. I noticed even this past weekend when I was grocery shopping that a lot of people weren't used to following those arrows, and it was very confusing. So just be aware that this is something that we're seeing now, and to follow those directions. And also, when you're waiting in lineup, make sure that you're staying adequate distance away. And I've seen a lot of stores where they're now marking on the floor when you're waiting to make sure that you're far enough away.
And I've also noticed that at the entrance, often there'll be some disinfectant that you could use.
Right.
Now there's there's also one thing that I think we need to be conscious of, that yes, this is just transmitted from person to person, but this also means that it can be sometimes transmitted through things that you touch.
Right.
And so I've seen somewhere the advice that you kind of, don't touch things on the shelf, look at them, and then put them back. Sort of try to avoid taking things off the shelf unless you're really absolutely certain that it's something you're going to buy.
Right. Right. Yeah. So I think that's a great tip, and a way that we can help prevent spreading COVID from ourselves to other people is just by limiting the number of surfaces in the store that we touch. I wanted to go back, Dr. Sharma. You had mentioned that some stores have hand sanitizer when you walk in. And I think that we've all been hearing these messages: wash your hands more frequently. But I wanted to give people some really specific advice about how often you actually need to be washing your hands. Now, before you go home to go to the grocery store, you certainly need to wash your hands with soap and water, okay? You also need to do that when you come home, and also after you finish unpacking your groceries. So I want everybody to wash your hands with soap and water on those 3 occasions, and that is the bare minimum, okay? Now I also
let me just ask you, so
yeah.
soap and water actually, as far as I'm reading, is probably even more effective than some of the disinfectants. But you have to wash your hands long enough, is that correct?
That's right. So you may have heard that you need to wash your hands for 20 seconds. When you are actually washing your hands, this feels like an eternity. And you may have seen videos where we're teaching kids how to wash their hands long enough, and we have them sing happy birthday or the ABCs when they're washing their hands, and that's useful for adults too, truthfully. The other thing that people can do is, remember, you don't just wash your hands like this. There's lots of surfaces and crevices to wash your hands in. So make sure you get between your fingers, make sure you get your fingertips, make sure you get in between your thumb right here, and that'll help you use that time as well.
And what about the hand sanitizers? Are they all the same? Or, if I'm in a hurry, is it, or if I don't want to wash my hands, can I just use a sanitizer? Is that as good, or is it less effective?
Yeah, so we do know that hand sanitizer is less effective. That said, it's a really great option when you need to wash your hands and you don't have access to soap and water, okay? Now, I always make sure that when I leave the house, I have hand sanitizer with me, okay? I carry around this little bottle, and I think that it's an essential item right now. Everybody, if you're going to leave the house, should have a little bottle of hand sanitizer.
So where do you get it? Because it's hard to get.
I was gonna say it's difficult to get right now. That said, you don't need very much. I filled this bottle up 3 weeks ago. I've been the person in my family doing the grocery shopping, and also I've been using it at work a little bit. And this is how much I have used. So you don't need very much. I know that if you don't have some, there's some of your family or friends that have a big bottle. I actually didn't have any, and remembered that I had some with my camping supplies. So if you haven't found any, I bet you that there's many others of you that have it with your camping supplies. Now, hand sanitizer, you should do the same rule. So you should take a long time, take 20 seconds when you put hand sanitizer on your hands. And the reason why I want everybody to carry hand sanitizer is because we know that the virus is can be spread on surfaces. So that if somebody has COVID and they cough into their hands, or perhaps rub their eyes or rub their nose and then touch a surface, and another person comes along behind them and touches the same surface, gets the virus on their hands and then onto their face, that's how the virus is spread from person to person. So I'm really careful when I go to the grocery store about those shared surfaces. So in addition to washing my hands before I go, I use my hand sanitizer when I first get into the store. And that's helping protect everybody else in the store if I have the virus, okay? And this is also why I'm most happy shopping at grocery stores where they have somebody at the front making sure that everybody uses hand sanitizer when they come in. The other time when I use hand sanitizer in the store is when I touch other commonly touched surfaces. So when I go to get my milk and I have to open the fridge, I'll use my hand sanitizer after that. When I pay and I have to use the credit card machine and touch that, I'll use the hand sanitizer after that. I think that if you are taking these extra steps, that's an extra layer of protection, and that would really go a long way to preventing this virus. Now, the other time when I also use it is, of course, before and after I touch my face, okay? So that's a lot of hand sanitizer. It's a lot of using it. You can see a little goes a long way. And it's really being really diligent around these simple measures that's going to slow down the spread.
What about people who think, well, all this hand washing stuff, why don't I just wear a pair of gloves and maybe then I'll throw them away in the parking lot, as unfortunately a lot of people are now doing, because I see these used gloves lying all over the parking lots. What's your take on gloves? Are they a substitute? Should we be even using them?
Yeah, I know that gloves are a really attractive option because it truthfully is tiring to wash your hands so much. Unfortunately, gloves are just as good as your hands at spreading the virus around. So if you are washing your hands less frequently because you are wearing gloves, they are not an adequate substitution. So I actually really don't feel good when I see people wearing gloves at the grocery store. I'd rather see them using hand sanitizer more frequently.
So when you think about, going out, we've already talked about the fact that it's best to do your shopping alone. Don't take the kids, don't go as a pair, but there's other ways that you need to prepare when you go out. So, do you bring your own shopping bag? Are there things that you'd rather leave in the car or leave at home when you go?
Yeah, so I really try to bring as few items as possible into the store with me. I bring, of course, my little bottle of hand sanitizer. I bring my payment card, and I bring my car keys and my shopping list. I leave everything else at home, including my phone, which I know is very difficult for a lot of people. And that's simply because if I'm touching surfaces and then touching my own surfaces, there's more likelihood for virus to get on things that I'm gonna then bring home.
Okay, so you leave everything at home. You're not carrying a bag. You're not carrying your phone.
I'm a person that always brings my own bags to the grocery store. I have been doing that since before everybody else was doing it, before it was widely accepted. My preference would still be to bring my grocery bag to the grocery store and bag my own groceries, but most stores are not allowing you to do that anymore. So I am using those plastic bags at the grocery store. Yeah.
What do you do when the groceries once you get home?
Mm-hmm.
Do you wash everything in Lysol, or what do you do?
Yeah, I think this is the area that I've had the most number of questions asked to me about. And I think it's also the area that probably right now is the most confusing, because it's the one area where there's the most divergence of opinions on what we should be doing with our groceries when we get home. So what I'm going to do is present a couple options, okay? One is what you should do at a bare minimum. At a bare minimum, when you get home, you wash your hands, you unpack your groceries, and you wash your hands again, okay? Now, people are wondering, can't the virus live on the surfaces of the boxes and the fruits and vegetables that I'm bringing home? We know that virus is not spread in food, okay? We know that much is true. But that said, there may be the possibility of transmission on some of these boxes We're not entirely sure how long the virus can live on a lot of these surfaces. We believe that it's somewhere between hours and days. Now, I know that a lot of people have been taking extra precautions and doing things like wiping down every box with Lysol wipes before they put them away. And if you're doing that and that makes you feel really good, then that's fine. Keep on doing that, okay? I'm doing something in between, okay? So I do the minimum, wash my hands, put my groceries away, wash my hands. The things that I'm really worried about though are the things that my kids are gonna grab at right away when I get home. Because truthfully, I don't know who's touched them and what's been on their hands. And my kids, especially when they are hungry, they are, they're impulsive little beasts. They have no self-control. So for things that my kids are going to touch, I might wipe them down or put them in the sink and wash them before I put them away.
Now, just because you're talking about the kids and snacks and things they like to eat, have you found that the kind of things that you buy at a grocery store has that list changed? Is there more snacks or is there less snacks on your list now?
This really is a time to be gentle on yourself, gentle on your family. I would say that, there are more convenience foods in my house right now. I'm buying things. I'm not going to the grocery store as often, so I am relying on things that have a bit of a longer shelf life. I have, much to my kids' pleasure, there have been a few more treat foods and convenience foods at home these days.
And have you gotten into the bread baking thing yet, or everybody seems to be baking?
You know what? I actually have, absolutely. And yeast is something that's actually has been a little bit hard to find. So I was very happy to find yeast in my grocery store this weekend. So
well, you could do your own sourdough starter.
What's that?
You could do your own sourdough.
Yeah, exactly.
All right, so let's finish this up by quickly talking about something that's come up a lot in the news now, and I know that the recommendations are very new. People are still thinking about it, and that's wearing a mask when you leave the house. What's your take on wearing a mask? What kind of mask should people use, and what's the real use of, why should we even think about using masks?
Yeah. So again, this has been a really confusing issue over the last week because we have been getting divergent advice from our different regulatory authorities. I think though, honestly, in the past few days, the messaging has really lined up. So we're now getting very consistent messaging. Now, the one thing that I want people to remember about mask wearing is that it doesn't protect you from getting the virus. It's all about preventing you from spreading the virus to other people, okay? Now with that, mask wearing is now something, it doesn't replace all those other important things that we talked about. It doesn't replace physical distancing. It doesn't replace excellent hygiene and excellent hand washing. It's an added layer of protection, okay? Now, certainly what we now know, or what we are now hearing, understanding, is that wearing a mask can prevent you from spreading the virus to other people. But there are a lot of things, if you are choosing to wear a mask, that you need to be aware of. One is that you need to wash your hands before and after you put on your mask. You still need to avoid touching your face. When you are done with the mask, you need to be very careful about disposal, okay? So it needs to go into a bag that is going to then go into the washing machine or go directly into the washing machine. So I'm talking now about homemade cloth masks, okay? I want everybody also to remember that those medical masks, we shouldn't be using medical masks in public. We are still at a point where we need to be reserving those for our physicians and nurses and other frontline healthcare workers, okay? Now, in terms of our guidance in Canada about what kind of masks we might wear in public, I haven't seen any specific guidance. And to be honest, before I make a mask and start wearing a mask, I'm waiting for more official guidance. That said, if people are keen to get started on it, I would go to the CDC website, and they offer some directions there, okay? Now, do you have to wear a mask right now? You don't have to right now. Right now, I'm choosing not to, but again, I'm going to stores where I see excellent infection prevention control measures in place, okay? I'm also expecting or anticipating that the recommendations for whether we need to wear masks more widely is going to change. So it's something that I'm going to keep listening to.
Okay. Well, Sarah, thank you so much for sharing these tips. I'm sure they're important to a lot of our listeners and viewers because as we discussed on the last on the last chat when I was talking to Dr. Sue Pedersen, we emphasized how important it is, especially for people living with overweight and obesity, to try to not catch this virus, because we know that they very often can have other risk factors that could make just for a more severe and serious course. So thank you again for taking the time. Thank you for those tips. The viewers, if you want to send questions to us in the comments, this is going to be posted on our social media. We'll try to get to those questions. We'll try to answer them online, and we might actually come back to this topic again in a couple of weeks, because these are all moving targets and things are changing.
Absolutely.
So Sarah, stay safe. Thanks for taking the time. Great talking to you.
You as well. Bye-bye. Stay safe, everybody.
Bye now.